I was at this big industry conference in Berlin last week. The keynote speaker, a major CEO, gets up on stage.
Okay.
And he's giving this incredibly earnest speech about the Fachkräftemangel, the skilled worker shortage.
Right. The big topic.
The big topic. He's pacing, he's pointing, saying, we must embrace experience. We need the wisdom that only time can bring. He said it's our most valuable resource. And the audience is just eating it up, nodding, taking notes.
The official narrative.
Exactly, the big official narrative. But then later, I'm at the networking reception, and I just happen to be standing near that same CEO while he's talking with his head of recruiting. And she mentions a candidate for a senior management role, says, he's perfect, 25 years in the field, stellar track record. The CEO just winces. He shakes his head and says, 25? God, no. Find me someone, form bar someone we can shape, keep it under 40.
Wow. That immediate pivot from experience is our most valuable resource to find me someone under 40. It's honestly stunning.
It really is.
And that contradiction, the public plea for expertise versus the private rejection of the age that creates it, that is quietly hollowing out the German labor market. It's an unfortunately perfect microcosm of a much larger conflict.
Like a global one.
Absolutely. You have this crippling national economic need for specialized labor, and yet the solution is being actively undermined by a deep-seated cultural bias. Yeah. This isn't just one CEO being quirky. It reflects societal prejudices against age that reject proven expertise, and it's costing the economy its health.
So that's our mission for this deep dive then, to unpack that hard evidence.
Exactly. We need to understand the structural, the social costs of this ageism. And we can use the recent crisis as a sort of stress test for how society truly treats its older members.
Okay, let's unpack this. Before we even get into the specifics of the labor market and that CEO's problem, we have to look at the foundations. What enables this rejection? I mean, age-based discrimination is illegal in Germany.
It is.
But clearly, the sentiment, what we call ageism, it's alive and well. It's informing these huge decisions.
It is, and it's deeply rooted in widespread belief. There was a large-scale survey done in Germany, about 2,000 respondents aged 16 and over.
Okay.
And it painted a very clear, and frankly, a rather grim picture of the prevailing negative opinions about seniors.
How so?
Well, for starters, 53% of respondents felt that older people do not actively contribute to social progress.
53%? That's more than half.
More than half the population. Essentially viewing seniors as socioeconomically passive.
When you hear that stat, it suddenly makes that CEO's comment about wanting someone moldable, it sounds less like a personal preference.
And more like a manifestation of a national belief.
Yeah, that at a certain age, you just stop contributing. You just need to be managed.
Precisely. And look at the other findings. About half of the respondents thought that people over the age of 70 shouldn't hold political office.
Wow.
And maybe most critically for the labor market, about a third of them said older people should surrender important roles, professional and social, to make way for the younger generation.
The pressure to just get out of the way.
It's pervasive.
So if that prejudice is so widespread, so institutionalized in the culture, never mind the law, the cost must be enormous. Are we just talking about lost productivity from the workers we need?
Absolutely not. The costs are far more insidious. They reach right into public health, the national budget. Ageism isn't just a social issue. It's a severe public health and financial burden.
How so? What's the connection?
Well, marginalization and discrimination creates stress. And external research, which is cited in these findings, confirms that this directly contributes to self-stereotyping, and that negatively affects health outcomes. The financial damage is staggering. In the U.S., for example, the annual health costs related to ageism are estimated at $63 billion.
$63 billion a year, just from the stress and illness caused by this kind of marginalization?
Yes.
That's an incredibly powerful connection. We usually focus on the Fachkräftemangel in terms of, immediate economic output we're losing. But you're arguing that when a society rejects experienced workers, it simultaneously creates a massive health liability that burdens the economy even more.
It's a double whammy of cost.
Yeah.
This, when you undermine the dignity and participation of one group, you create instability and, unnecessary financial drains on the whole system.
Right.
And if that was the baseline bias going into the crisis, the pandemic served as a major stress test. It revealed the true weight of those assumptions.
Right. And this is where it gets really interesting, because when the pandemic hit, older people were immediately put at the center of everything as the vulnerable group needing protection. So how did that focus on protection expose these deeper ethical and social challenges?
The crisis forced policymakers to confront these core ethical requirements, specifically the concept of human dignity. This goes back to philosophy, to thinkers like Immanuel Kant, and it prohibits the instrumentalization of any person. In plain terms, that just means you can't treat an individual merely as a means to an end.
So you can't just isolate one group to, say, minimize the overall economic cost or maximize freedom for everyone else.
You can't. A strict isolation measure has to be fundamentally for that person's well-being and life preservation, not just to clear hospital beds for the younger workforce or restart the economy.
That's a very fine line to walk in a crisis.
A very fine line. The German Ethics Council was explicit on this. They asserted a principle called Lebenswertendifferenz,
which means
the equal worth of life. It means that when you're prioritizing resources, even in extreme cases like triage, you cannot base it on calendar age or social role or how many years someone might have left.
Yeah.
The big risk for policymakers was that if those protective measures were seen as being primarily for the economy's sake or for the freedom of the young,
they would be violating the fundamental dignity of the elderly.
By treating them as an instrument for others' benefit.
Exactly. And the public discourse, I'm guessing, did not help uphold this very nuanced ethical standard.
It actively made it worse. The media often contributed to the problem by labeling the elderly, with no differentiation, as the risk group.
Right. Just one big monolithic block.
This constant homogeneous representation just amplified the ageism and stereotyping. It reinforced that idea we started with, that their vulnerability was their defining characteristic. It didn't acknowledge their complex lives, their resilience, or their ability to make their own informed decisions. One expert even noted that this discourse made it sound like contact with older people was just inherently risky.
Which would lead people to actively avoid them.
Of course. The societal message became, if you are old, you are a problem to be contained.
So the measures were often deemed necessary, but let's look at the actual human cost. That mandated protection, that isolation. What did the data show about the real psychological fallout?
It was severe, especially when you look at the Haltridge people age 80 and over.
Yeah.
Austrian studies show their social life was just devastated.
Yeah, how bad was it?
A huge majority, 87.1% of the 80-plus group reported reducing meetings with friends or acquaintances. And 55.6%, they halted them completely.
Over half. So for a period of time, over half of people over 80 completely lost their social circle.
Yes. Think about that. We know how crucial social connection is for health at any age.
That is just staggering and devastating.
And the psychological impact followed immediately. The prevalence of, say, occasional loneliness in this group. It jumped from just 4.6% before the pandemic to 26.9% during the crisis.
A more than five-fold increase.
Yes, it shows the severe unintended consequences of policies that prioritize physical security above everything else. And while this group largely complied with the measures, 93.5% agreed on mask mandates, the consequences were a measurable drop in life satisfaction and a strong correlation with increased depressive symptoms.
That really grounds the policy in human terms, doesn't it? We focus so much on the biomedical data, the mortality rates, but that surge in loneliness, that's the real invisible cost.
It absolutely is. And we tend to focus on the oldest group, but what about the active aging group? The 55 to 79-year-olds still very engaged professionally or in their communities.
The very age bracket that CEO from the start was trying to avoid hiring.
Exactly. And here we see clear gender differences in that 55 to 64 age bracket. We found that nearly half of the women, 46%, were affected by professional changes like job loss or short-time work.
And for men?
Just over a third, 36%. So women faced higher professional disruption, more financial precarity.
So the crisis amplified existing inequalities in the labor market. It pushed older women out of the workforce at a greater rate.
It seems so. Yet in this fascinating counterpoint, women in this age group showed incredible resilience and community spirit in other ways. 4 out of 10 women in this age group actually increased their voluntary engagement during the crisis.
4 out of 10? That's a lot.
It's significantly higher than men. Only 9% of men increased their engagement. It shows that while they might have been financially compromised, their social and civic value was incredibly high and probably undervalued by employers.
So the policies were meant to protect, but they clearly created intense new pressures, new conflicts, often within the family itself.
A massive strain. Among the high-aged respondents, about 20% reported conflicts or disagreements with relatives.
And what were they fighting about?
It was highly specific. 90.9% of those conflicts were about the pandemic itself. Disagreements over the measures, how dangerous it all was, the necessity of the rules.
So public health policy became the source of dinner table arguments. That must have made the isolation feel twice as painful.
It absolutely did. And we also saw this painful alone living paradox. For some people living alone, already mobility restricted, the rules didn't drastically change their daily routine.
Yeah.
They were already isolated. But they reported this deep sadness over the acute loss of physical intimacy, not being able to hug a grandchild. And these individuals often expressed immense worry about the institutionalized elderly, who they felt were being, quote, locked people away.
Institutional care was maybe the toughest setting for balancing dignity and safety. We all saw some truly heartbreaking stories from care homes during the lockdowns. What were the different viewpoints on those measures?
There was a stark contrast. Some staff members reported that the lockdowns led to a calmer environment, that it allowed them more time for residents because routine visits were cut.
Wait, hold on. A calmer environment, isn't that a dangerous sign? That maybe convenience for staff was prioritized over the residents' fundamental need for social connection?
That raises the critical point about instrumentalization again. If the calm comes at the cost of the residents' freedom and family connection, then the policy has failed to uphold their dignity. It's an easy trap to fall into when safety is the only metric.
And for the most fragile residents.
It was especially damaging for people with cognitive impairments, like dementia patients. Nonverbal cues, mimicry, close contact, touch are crucial for their well-being. Masks and social distancing put an extraordinary burden on them. It likely contributed to cognitive decline and increased mortality risk from social isolation.
So the very measures designed to save them physically.
Something to compromise them psychologically and socially.
So let's bring this all together. The contradiction we started with, that CEO rejecting experienced workers while publicly praising wisdom, it's all underpinned by this deeply embedded societal view of older people as passively vulnerable.
And the pandemic dangerously reinforced that view.
We really saw the true cost of that simplistic thinking.
The data confirms it. Older individuals are incredibly heterogeneous, often very resilient, drawing on lifelong coping skills. But discriminatory policies, whether in hiring or public health, they fail to see that multidimensional nature. We have to move beyond a narrow biomedical idea of vulnerability.
And consider the social and psychological factors.
Exactly. We need strategies that acknowledge the economic stressors, like the financial precarity we saw in older women, and ensure that social participation is maintained. Older people can make nuanced decisions about risk and participation. We lose so much value when we reduce them to a single health metric.
So the ultimate takeaway here seems to be the need to institutionalize what's called mainstreaming aging. If society really wants to benefit from the wisdom and participation of older generations and finally address huge needs like that skilled worker shortage we began with, it has to proactively integrate their needs and their diversity into policy across all sectors.
If we continue to use ageism as a convenient default way to structure our society, we aren't just wasting decades of expertise. We're actively choosing to exacerbate our own economic crisis.